Hello, and welcome to Nursing Research Tips, a show dedicated to sharing best practices, tips, and other resources within the areas of nursing research and evidence-based practice. I'm your host, Jenny Barrow, Associate Professor of Undergraduate Nursing, who specializes in teaching students real-world content to help transform their future nursing practice. I enjoy taking the boring world of research and EBP and making it come alive for my students. And that's what I intend to do with this podcast. On today's episode, I have some special guests from my university's undergraduate nursing research and EBP course. Colin Faulk, Meagan Mayfield, Kylie Melton, Shaun-Lee Peynado, and Joelle Pitre are joining us to discuss their evidence-based practice project. Let's turn the show over to Kylie to get us started.
Hello, listeners. My name is Kylie Melton, and on behalf of my fellow group members, I'd like to welcome you to our podcast discussing the work we have completed in our undergraduate nursing research and evidence-based practice course. The title of our presentation is Tight Glycemic Control in the ICU, and the members of our work group are Colin Faulk, Meagan Mayfield, Kylie Melton, Shaun-Lee Peynado, and Joelle Pitre. We are all undergraduate nursing students at McNeese State University in Lake Charles, Louisiana. In today's episode, we'll be exploring the importance of maintaining tight glycemic control in intensive care unit patients, the complications associated with poor glycemic management, and how this practice can ultimately impact patient outcomes. We hope this discussion provides valuable insights into the significance of evidence-based nursing practices in improving patient care.
Thank you for introducing your team and your overall project topic to our listeners, Kylie. It sounds like your group focused heavily on the critical care nursing specialty for this project. I wonder if this may be because one or more of you hope to work in the ICU setting once you graduate with your BSN. So, Kylie, can you tell our listeners a bit more about why you feel this topic is important?
In the ICU, hyperglycemia and hypoglycemia are common issues that can significantly impact patient recovery and overall health. Our group chose this project because glycemic control is a critical factor in patient outcomes, yet it is often difficult to manage effectively in the high-stress ICU setting. The variability of patient conditions, fluctuating glucose levels due to medications like corticosteroids, and the stress response from critical illness make maintaining optimal blood sugar levels particularly challenging. Tight glycemic control refers to the practice of maintaining blood glucose levels within a narrow optimal range, typically around 80 to 110 or according to institutional protocols. This practice aims to reduce complications and improve patient outcomes. Research has shown that effective glycemic management can lead to decreased infection rates. ICU patients with uncontrolled glucose levels are more prone to hospital-acquired infections, such as pneumonia or bloodstream infections. Tight glycemic control reduces this risk by promoting better immune function and minimizing bacterial growth. Lower risk of organ dysfunction. Stable glucose levels support better organ function and reduce the likelihood of complications such as acute kidney injury, cardiovascular issues, or neurological impairment. Shortened recovery times. Patients with well-managed glucose levels often experience faster recovery and shorter ICU stays, which improves patient well-being and hospital efficiency. Reduced mortality rates. Some studies indicate that in patients receiving tight glycemic control have a lower risk of death, particularly in post-surgical and critically ill populations, and improved resource utilization. By preventing complications, tight glycemic control reduces the need for prolonged ICU stays, additional interventions, and costly treatments, ultimately helping healthcare systems allocate resources more effectively. For the nursing profession, this topic is highly significant. Nurses play a direct role in monitoring and managing blood glucose levels, administering insulin, and identifying early signs of glycemic fluctuations. Tight glycemic control requires constant vigilance, as both hyperglycemia and hypoglycemia can have serious consequences. By understanding the evidence-based benefits of tight glycemic control, nurses can provide higher quality care, reduce complications, and promote better patient outcomes.
Thanks for explaining what tight glycemic control actually is and explaining some of the potential benefits of tightly controlling these blood glucoses while these patients are in the ICU, Kylie. You've provided our listeners with a solid background for why this overall topic is significant for the nursing profession. So, Joelle, can you tell us what your group did next within this overall EBP project?
Now that we've highlighted the importance of this evidence-based practice topic in nursing, I'd like to introduce our group's research question. To ensure a structured approach, we formulated our question using the PICO framework, which incorporates key elements such as population, intervention, comparison, and outcome. The guiding question for our literature review was, among critically ill patients, what impact does maintaining strict blood sugar control, as opposed to standard glucose management, have on rates of complications and the duration of ICU hospitalization? By exploring this question, we aim to determine the most effective approach to managing blood glucose levels in critically ill patients to improve overall outcomes.
Thanks for sharing your group's PICO question with our listeners, Joelle. This question served to focus your group's investigations into the published literature. Can you tell us more about how you use that PICO question to help you find published research studies about this topic?
We used our group's PICO question to create keywords to search the following university library databases: CINAHL Complete, Academic Search Complete, and Health Sources Nursing Academic Edition. Some of the keywords that we used for our searches included glycemic control, ICU stays, morbidity, and tight glucose control. We set specific search limiters on our searches, including full text availability, peer-reviewed and scholarly sources, publication within the last 5 years, and a focus on quantitative research. During our literature search, we found that using Boolean operators like and or helped refine our research results significantly. Searching with different keyword combinations also provided a broader range of relevant articles. One challenge we encountered was filtering out studies that were not directly related to ICU patients, despite including specific keywords. Adjusting search terms and reviewing abstracts quickly helped us identify the most relevant articles. A helpful tip for more efficient searches is to use subject headings in databases like CINAHL to find the most accurate research articles. Additionally, keeping track of search terms and results in a spreadsheet helped us avoid duplicating efforts and ensured a well-rounded search process.
I appreciate that you shared some helpful insights into your group's literature search process, Joelle. Thank you for sharing your best practices of professional database searching, such as adjusting the search terms when you're not quite getting the results you think you should, documenting those completed searches to avoid duplication and extra work, which is super important when working as a team, and incorporating those Boolean operators, like you mentioned. These are fantastic skills to promote the utilization of best evidence in your future RN careers. So, after your group reviewed these retrieved peer reviewed studies, what key evidence did you discover pertaining to your group's PICO question?
After conducting an extensive literature review, our team synthesized key studies addressing the relationship between glycemic control and critical care outcomes. We evaluated high-quality studies, each critically appraised by our team members, to understand just how tight glucose management influences ICU patients. So let's start by discussing the most significant finding, the fact that tight glycemic control actually does reduce ICU stay and ventilation time. Patients in this intervention group who had strict blood glucose management spent less time in the ICU and actually had shorter ventilation times than those in the control group. This highlights the fact that maintaining stable blood sugar levels can lead to faster recovery and reduced resource utilization. Another key finding was the J-shaped association between blood glucose levels and the hospital mortality in non-diabetic patients. This means that both extremely high and low glucose levels were linked to increased mortality risk. Interestingly, though, diabetic patients showed a different pattern, a right-shifted and flattened response, which indicates less sensitivity to hyperglycemia, mostly being because their bodies are more accustomed to being in a high sugar state. So now let's talk about infection and mortality rates. The studies consistently showed that patients in this intervention group had fewer infections and lower mortality rates than those in the control group. This suggests that better glycemic control may strengthen immune response and reduce complications in critically ill patients. Another critical point is that glycemic dysregulation is common in the ICU. Approximately 29.9% of ICU patients experienced abnormal glucose levels, with 4.7% suffering from hypoglycemia and 25.2% from hyperglycemia. Notably, diabetic patients were more prone to unregulated glucose levels compared to non-diabetic patients. Despite the benefits of glycemic control, achieving the target blood glucose level remains a challenge. Only 11.8% of all ICU patients reached optimal glucose levels during this testing, even though most of them were receiving glycemic control interventions. The reason for this may be due to the widespread use of the sliding scale insulin method, which is favored by most doctors and nurses. But despite being favored, this approach may not be as effective in maintaining stable blood sugar levels. So, what does this mean for clinical practice, you may ask? Well, the finding emphasizes the need for better trained and standardized protocols for the glycemic management in the ICU. Research indicates significant gaps in knowledge, particularly in hyperglycemia management, with notable training differences between the doctors and the nurses. Addressing these gaps through structured education programs and evidence based protocols could lead to better patient outcomes. In terms of optimal blood glucose ranges, non diabetic patients had the best survival outcomes within 80 to 20 milligrams per deciliter, while diabetic patients fared better in the 90 to 150 milligrams per deciliter range. Additionally, surgical and trauma patients showed a greater tolerance for lower glucose levels compared to medical patients, suggesting the need for a tailored glycemic control strategies based on the patient's demographics and underlying conditions. So we have to look at more at it as an individual based than as an overall. So to sum it up, tight glucose control plays a vital role in ICU care, influencing ICU stay duration, ventilation time, infection rates, and overall mortality. However, challenges in achieving effective glucose regulation remain, underscoring the importance of improved clinical protocols and training.
Excellent discussion of the studies that your group reviewed, Colin. I really appreciated the clarification of how the research studies found differing results depending on whether the ICU patient was actually previously diagnosed with diabetes or not. Our listeners may have assumed that ICU nurses would only be worried about tight glycemic control for those patients who are actually diabetic, but that's not necessarily the case according to the research your group reviewed. Now, Meagan, can you tell our listeners about some additional key implications that nurses across all the ICU specialty should consider based on this literature your group reviewed?
Based on the information our group reviewed, we noted some synthesized implications for nursing practice. We know that tight glycemic control can significantly improve patient outcomes. Research shows it can reduce ICU stays, ventilation time, infections, and even mortality rates. But it's just not about maintaining a specific glucose level. What really matters is managing glycemic variability. When blood sugar fluctuates too much, it can increase the risk for complications. That's why keeping glucose levels stable is just as important as keeping them within a target range. This has direct implications for nursing practice, particularly in the ICU, surgical recovery, and emergency settings. But it doesn't just stop there. Nurses in endocrinology, telemetry, and even long-term care can benefit from understanding how to better manage glucose control in their patients. One of the biggest discussions right now in the medical field is whether a universal glucose target works for all patients. The trend is shifting toward individualized glucose control, tailoring targets based on each patient's condition and response to treatment. As nurses, we play a vital role in monitoring and adjusting glucose management strategies. This means staying informed, advocating for best practices, and working with an interdisciplinary team to ensure the best outcomes for our patients are achieved.
Thanks, Meagan. You provided our listeners with some helpful takeaways pertaining to the importance of critical care nurses remaining vigilant in the assessment and management of their patients' blood sugar trends. So, Meagan, did your group find that there are any gaps in the present literature that may require further future research studies?
There are still some knowledge gaps remaining in the published literature surrounding our topic. Therefore, our group developed some implications for research. One of the biggest questions that remains is the long-term impact of tight glycemic control. We know it improves short-term outcomes by reducing ICU stays, ventilation time, and infection rates, but what happens after discharge? Future studies should explore its effects on patient morbidity, mortality, and overall quality of life in the months and years that follow. Are these patients experiencing fewer complications? Are they at a higher risk for long-term metabolic issues? These are critical questions that still need answers. Another important area for future research is identifying the safest and most effective blood glucose range for critically ill patients. While keeping glucose levels controlled is important, we also know that hypoglycemia can be dangerous, increasing the risk of complications and poor outcomes. So, where is the ideal balance? Research is needed to determine the best target range that maximizes benefits while minimizing the risks. This would provide clearer guidelines for healthcare providers, especially the nurses who are responsible for daily glucose monitoring and management. And finally, a major focus for future studies is personalized glycemic control. Right now, standard glucose targets are applied broadly, but we know that every patient is different. Factors like age, underlying conditions, and the severity of illness could all impact how tightly blood sugar can be controlled. Future research should explore how individualized approaches can improve safety and effectiveness, ensuring that each patient gets the level of glycemic management that best supports their recovery. These research gaps highlight the importance of ongoing studies in this field and the need for evidence-based practice in nursing. As nurses, we play a vital role in monitoring, adjusting, and advocating for the better patient care based on the latest research findings.
Okay, so your group has given us a lot of excellent information about the current state of the science surrounding your selected clinical practice topic. After all of the research studies that you reviewed as a group, including considerations for weaknesses within the reviewed studies and continued gaps in the present literature, what was your group's overall literature-based answer to your original PICO question?
After reviewing multiple research studies, our group was able to determine an evidence-based answer to our evidence-based practice question. Tight glycemic control in intensive care unit patients leads to improved outcomes. The literature strongly supports that maintaining blood glucose within a strict range can reduce infection rates, decrease organ dysfunction, and shorten intensive care unit stays. For example, a study done by Abdel-Badi et al. 2022 found that intensive insulin therapy significantly lowered morbidity and mortality in critically ill patients. Similarly, research by Belair et al. 2023 showed that strict glycemic control reduced ICU length of stay and hospital mortality. One of the most important takeaways from our research is that glycemic control plays a critical role in patient recovery. Studies have shown that intensive care unit patients with tighter glycemic regulations experience fewer infections, shorter ventilation times, and a more stable blood glucose level. However, glycemic dysregulation, both hypoglycemia and hyperglycemia, remains a common issue, with nearly 30% of ICU patients experiencing blood sugar fluctuations. This highlights the need for individualized glucose management strategies rather than a one-size-fits-all approach. From a nursing perspective, this project has reinforced the importance of evidence-based practice. Research is essential in guiding clinical decisions that directly impact patient outcomes. By integrating the latest findings into practice, nurses can play a key role in managing glycemic control and preventing complications in critically ill patients. Understanding the balance between tight control and individualized care will help us provide safer and more effective treatment. Ultimately, this experience has shown us that evidence based practice is not just about reviewing studies, it's about applying what we learn to improve patient care. As future nurses, we will continue to use research to guide our clinical practice, ensuring that the care we provide is both effective and supported by the best available evidence.
Thanks for wrapping up your group's discussion, Shaun-Lee. I'm proud of each and every one of you for integrating the content that we've discussed in our undergraduate nursing research and EBP course into a real-world literature search process. I'm so glad to hear that your group understands that evidence-based practice is not just a fancy buzzword that we throw around in nursing school. Nurses in all settings and across all specialties can make an impact on their patients' outcomes by knowing what the synthesized research says on topics of importance to us as nurses, and then integrating that evidence into our actual clinical practice. I'd also like to thank our listeners for going on this journey with us. Even if you're not a nurse, you or someone you love has been, currently is, or will be a consumer of healthcare services. As a consumer of healthcare, you need to know that your nurses are well versed on providing the safest, most up-to-date clinical practice that will help you optimize your healthcare outcomes. These students are well on their way to becoming those very nurses. Thanks again for joining us.